Today's episode is sponsored by Whole Mission. Learn to chart your fertility simply and objectively with a healthcare professional teacher at Whole Mission. You can use the latest research and technology to help you navigate the highs, lows, and peaks of natural family planning with confidence and a 98% effectiveness rate using the Marquette method of NFP. Learning to chart your fertility might seem intimidating, so let the teachers at Whole Mission take the guesswork out of it. The class offerings at Whole Mission are recommended for single women desiring to understand their health, for engaged couples preparing for marriage, for postpartum moms seeking to simplify their charting routine, and women in perimenopause who are getting ready for the new changes and more. Find out more about Whole Mission's model for whole person health education at www.thewholemission.com. That is thewholemission.com.
I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh.
It's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone.
Hello and welcome to the Hormone Genius podcast. My name is Teresa Kenny and I'm here with my co-host Jamie Rocci. Today we're going to do a podcast episode on a particular topic that we think we want to provide context to and an overview of, because we often bring up this word within our podcast and then we try to explain it in a short way. But this podcast, we're going to give more detailed information about a woman's health science or a way to approach health that will allow you to understand if you, as a person seeking healthcare, are called to this type of health. And this word is called Naprotechnology. And this is a word that was developed by a very particular doctor named Dr. Thomas Hilgers, and he resides in Omaha, Nebraska. The word stands for Natural Procreative Technology. And we're going to get into what is the science behind Naprotechnology, what does this all mean? How is it linked to what we do and what we explain in the Hormone Genius podcast? And so I'm excited because I think this will be a really nice foundation in understanding this alternative that we have out there in women's healthcare that many of our listeners are called to because they're looking for a more restorative approach, a more cooperative approach to the treatment of their women's health issues.
Yes, Teresa, I'm excited to talk about this because, like you're saying, many of our listeners have heard us say Naprotechnology, and I often talk about Naprotechnology, forgetting that people don't really maybe know what that is. So again, for those of you listening and you've heard us talk about Naprotechnology, be rest assured it'll make sense to you by the end of our episode. So also, just so you know, Teresa, the reason we are excited about talking about this topic is because Teresa is trained in Naprotechnology as a medical professional, and I am trained in the Creighton method, which aligns with the Naprotechnology. So we'll also talk about how that partnership works between a Napro provider or a Napro professional, medical doctor, and a fertility care practitioner. So I'm excited about that.
Absolutely. So let's talk about kind of where it all started, Jamie.
Yeah.
I love this story because it really goes back to when Dr. Thomas Hilgers was an early OBGYN, and he was looking for a way to help couples plan their families. So he developed a natural method to achieve and avoid pregnancy called the Creighton model system. And what happened after this, he wasn't even expecting in terms of kind of this development of an alternative way to approach women's health. The Creighton model system is what we call a mucus-only natural method to achieve and avoid pregnancy. And so it's a daily understanding of vulvar observations. Vulvar just means that these observations are only done from the outside of the body. And a woman records what she sees on a daily basis in order to understand her fertility. So in Creighton model system, we often say, every day you will know whether you're fertile or infertile. And this is a very science-based, very objective, very standardized method of recording what a woman determines to be fertile and infertile. And it was highly successful, and it was studied, in a very large study. I know it was over 4 centers. And I believe, do you know how many couples, Jamie, there was in the big study for Creighton model?
I don't remember.
Yeah.
I don't remember.
It was thousands of couples, and it was found to be 98.6% effective for avoiding pregnancy. So it was one of the very first kind of natural methods that was held up as, wow, this is not just your grandma's rhythm method.
Right.
And a couple could learn to chart their fertility, chart their cycles and their fertility, and be able to plan their family. And this was, something that was important to people of faith who, in religious practice, did not believe birth control was, something that they could do ethically. And so it gave them not only a way to practice a natural method that was effective, but it allows them to live out the lifestyle that they wanted to live out. Mm-hmm. So that was the Creighton model system. And Jimmy, am I leaving anything out about kind of Creighton model and what you understand of it?
Well, something that really resonated with me was just this idea where, like you said, Dr. Hilgers almost by accident figured out like this second leg of what this whole thing is. So, I think it was in the 70s that he started the Creighton method. Okay, in the 70s. And so again, like you're saying, Teresa, as a way for avoiding and achieving pregnancy that's effective, because sometimes people assume, I'm making a general statement, Teresa, but sometimes people assume that if we are not pro birth control, that means that we are pro unlimited number of kids. They just assume maybe that's the case. And if you tie not necessarily being for birth control with church, then that definitely is the assumption. They're like, oh, you're doing this for a religious reason and you are not for the birth control. That means that you mean that all women should have 1 million kids. And that is not at all the case. Actually, the cool thing about Dr. Hilgers in his work is that actually he found a very effective way to plan family size while still being faithful to faith convictions, which I think is just a beautiful combination. So first factor, like you said, avoiding and achieving pregnancy. The second thing that I think is so cool, Teresa, is when he was working with women, because he's trained as an OBGYN, when he was working with women, he noticed that the women who were not achieving pregnancy and were using Creighton as a charting method, and again, it's using stamps, it's noticing your biomarkers, and we could talk a little bit more about that. But he was noticing that the patterns of women that had similar gynecological diagnoses, so PCOS women, the PCOS women would have charts that kind of look the same, and then the women with endometriosis, these women have charts that kind of look the same. And that was the accident, I think, right, Teresa, where he didn't go out and try to figure that out initially. He was trying to give an alternative to women who didn't want to be on the pill and still effectively plan family size. But because of his professional expertise, his goal is to help women achieve pregnancy. So there was head scratching moments. Mm-hmm. And he's like, oh my gosh, these charts all look the same and they all have these similar things. So I think that is incredible, Teresa. And so that's what I wanted to share.
Yeah. And like you said, Jamie, they use this word called biomarkers. So it was kind of like, you have this map in front of you and you're seeing clues that's taking you to the answer, to the treasure, to where you want to go. So these biomarkers are what out of Creighton model charts, they research. So a lot of research was done on these charting methods on the Creighton model system. And then what Dr. Hilgers did is he applied that research to what he knows as an OBGYN and created what is now known as Naprotechnology, which, there's a really great website that a good friend of mine and her husband put up, Dr. Naomi Whitaker and her husband, Brian, called buyitsfruit.org. Buyitsfruit.org. So I'm referencing this because it's just an easy place anybody could go and they could look at the research done in Naprotechnology, find research articles. Because a lot of times when we're talking about this, they're like, how come I've never heard about this? Like, how come people don't talk about this in the regular OBGYN world? Well, it's largely unknown still, although I think known more than it was 20 years ago. And it's hard to sometimes know where to find all the science behind it. So this buyitsfruit.org was a website that was put up where people are putting all of the research in Naprotechnology and restorative reproductive medicine in one place. So if you're like, hey, I want to know the science behind this, you can go to buyitsfruit.org. And then you can also go to Facts About Fertility, because they put a ton of research in relationship to different areas of restorative reproductive medicine as well. But I found some great Naprotechnology articles on the Facts About Fertility site as well. But yeah, it gets into this idea that many of us, when we went into women's health, kind of were shocked by the fact that since the birth control pill has been out and available, although it was this huge, it's considered such a huge advancement in science, right? Having this access to a medicine that allows a woman to, control her fertility per se. But it also then became this one for all treatment for everything in women's health. So it really changed the way we looked at the woman's body. It wasn't a situation like in all medicine, we should be looking at the body and saying, okay, your heart isn't functioning normally. So what's the underlying root of that? And how do we correct that underlying root problem? Well, because of the birth control pill, it just became kind of too easy in a sense. And, women were just being given the pill for everything: irregular cycles, PMS, acne, painful periods, heavy periods, all of those things. It was like, well, we've got this birth control pill and you can just take that. And yes, would it help some women with those symptoms? Absolutely. But is it going to what the problem is? And if we really believe that the endocrine system is something that should be restored to health, then we're not doing that with the pill. Mm-hmm. We're not doing that. And so this is a paradigm shift for those who are in women's healthcare to see the woman's body as first and foremost a good in its own, and to try to correct what the underlying root cause of the problem is. So in Naprotechnology, they'll say it's, real solutions for real problems in women's health. So this is like the real solution versus kind of a temporary solution or a Band-Aid approach treatment.
I think about that a lot. I think, gosh, if we, on the onset of the pill in the 60s, we kind of pushed pause, accidentally probably, on any advancements in endocrinology, in reproductive health, women's health. We pushed pause on all of it so we didn't have to get to the bottom of, why does this woman have such painful periods? Well, she has painful periods, so I'm going to give her a pill so she doesn't have painful periods. But the question of why stopped being asked, but we don't stop asking the question of why when it comes to any other health system in our body. And therefore, when we ask the question of why and how come, then we have to do the research to figure it out, right? And every other health system, like our brain, we all know that there's always new research about brain health and heart health and gut health and all these things. But all the things that we could have learned about our fertility cycle and reproductive health stopped. It stopped because we stopped asking the question of why. And so now I think we're trying to catch up, and Dr. Hilgers was ahead of his times. And actually, he probably wasn't necessarily ahead of his times. He was just living in the times and didn't push pause. You know what I mean? Yeah. He just kept going when all the rest of the world stopped in terms of trying to find what's best for women and getting to the root. And that's what always makes me so frustrated, but gives me so much hope. A lot of women might be like, why don't we know more? I'm like, because we stopped asking the question of why, about 60 years ago. So now we're trying to catch up.
Yeah, absolutely. So, Jamie, let's talk about exactly those biomarkers, that a doctor or a medical consultant, of course, I'm not a physician, I'm a women's health nurse practitioner. I went through the training to become what we call a medical consultant, which just means that, we go to this training that Dr. Hilgers, he created so that we can practice in this way, in this restorative, cooperative way to the woman's body. So I went through that training years ago. That was in 2001. But what we're taught to do is to really see these charts and to kind of pick up these clues, these what they call biomarkers in the charting. Jamie, I mean, both of us taught Creighton model, because I, as a nurse practitioner, also taught the Creighton model system. And I think that was very helpful for me as a healthcare professional because, I had to really learn it. It wasn't just, oh, I see these couples charting this chart. No, I was teaching it. And that's a whole different kind of mindset around it. Jamie also taught the Creighton model system for years. So, Jamie, what were the things we can go back and forth on? What are these biomarkers that, you as a woman, you can start to understand this. Obviously, we encourage you, if you're interested, to find Creighton model and use it and, find a doctor that can help you. But what are some of these biomarkers that we're seeing that lead to these, solutions to problems in women's health?
Yeah, I'll start with some of the healthy and typical and what we would expect, those biomarkers that just indicate where we're at within our fertility cycle. And then I'll talk about some symptoms or some data where our body is telling us something may be off. And we notice that by seeing that in our charting patterns. So biomarkers are things we notice day to day. So biomarkers, our biology are giving us data. So our period, that's a biomarker. It means that we didn't get pregnant from the cycle prior and our uterine lining is sloughing. Our period is a biomarker. And the data of our period, I always like to think about our period as the diary from the cycle prior. So the biomarkers of our period even have a closer to the ground kind of system. So what color is our blood? Is it a pink? Is it a brown? Is it a bright red? What color? What is the flow? How many days are we noticing our period? And so we're marking those down as a Creighton client, let's just say, and as a fertility care practitioner, I'm teaching the clients how to do that. So asking those questions, what's the flow? What's the color? Let's mark those down. And we use a very standardized way to chart that so that way I could see a chart from a woman charting in China and I still know what her cycle's like. So that's the beautiful part about Creighton is that there is the standardized language. So you could live in Florida and move to California and still find somebody to help you with your chart because all Napro doctors are trained the same way. So as a fertility care practitioner, I'm training women to understand their chart, and then that woman takes her chart to the doctor. So biomarkers, so period. And then we notice our cervical mucus. So cervical mucus indicates increasing estrogen, which means we're fertile. So when you have cervical mucus, that you consider that as a day of fertility. That is also a biomarker. But there are different characteristics of our cervical mucus that give us information about where we're at in our estrogen genius phase. So typically women start off as a sticky, pasty, cloudy sort of type of discharge, and then it loosens up and it clears up as you approach closer to that ovulation time. So that's a biomarker, is that cervical mucus. So often I think women know when they get their period because it's obvious and bright red, you need a tampon in a pad. But for women with their cervical mucus, sometimes it gets lost in the toilet paper, or we might think we have an infection, or we, peed our pants. I don't know. Some people do think that. They're like, oh, that's just urinary leakage. I'm like, no, that's called cervical mucus. So those are the two that we can start with. Is there anything in addition to those two biomarkers, specifically, Teresa, that you want to add?
Well, those are the two. Bleeding and the discharge patterns are the main ones because Creighton model is, again, kind of only looking at the fluids in a sense coming from our body. They don't look at body temperature. I mean, there's other things like pain, of course, like abdominal pain that can be symptoms that are added into the chart. But the main things we're looking for are the bleeding patterns and the discharge patterns. So in that, Jamie, of course, you kind of described the normal patterns, but what we're also looking at is what could be abnormal. And we've talked about this on Hormone Genius before, but in the bleeding patterns, the things that are abnormal we look for are premenstrual spotting. This is, more than 1 or 2 days of bleeding before the actual flow gets started. So you might have someone that spots for 3 to 5 days before their actual flow becomes medium to heavy in their period. And that can be a sign or a biomarker of something abnormal. And then also there's tail end bleeding or tail end brown bleeding in particular. At the end of the period, more than 1 or 2 days of that could also be a biomarker of hormonal dysfunction or even infection or inflammation in the uterus. So those are two with the bleeding. Another bleeding sign that would be abnormal would be bleeding that's not in the period. So intermenstrual bleeding or spotting in the middle of the cycle, or spotting all throughout the cycle. That's a biomarker that tells us, particular patterns can even tell us this is more likely to be an endometrial or uterine polyp. This is more likely to be a cervical kind of infection. And again, this is patterns that may look like hormonal abnormalities in the cycle. So the bleeding patterns are very important. And then there's the discharge patterns. And with that, Jamie, what are the ones that with mucus that could signal maybe a clue to an underlying problem with women's health?
Well, I would say the first is just lack of cervical mucus. So if a woman is noticing very limited mucus, that may be a sign of a hormone imbalance, namely lower estrogen likely, but there could be other things going on too. So cervical crypts are what produce cervical mucus. So there could be damage to the cervical crypts. Cervical crypts are within the cervical canal. The cervix is the neck of the uterus. So the cervical crypts communicate with our ovaries. And so as estrogen is increasing, cervical crypts produce the mucus. So we always have to think about what's happening upriver. So if we think, okay, I'm not noticing mucus. Well, where does mucus come from? Mucus comes from cervical crypts. Okay. What is mucus? Well, it's fluid. So we can ask ourselves, are we drinking enough water even? Then we can think, well, why do I produce cervical mucus? Well, it's because of estrogen. So then we can ask ourselves, well, I wonder if my estrogen levels are off. And then we can ask questions like, how much do I weigh? Am I too little? Do I not weigh too much? Or weigh enough where I'm not ovulating at all? So it's always, the way I think of it, I'm always asking the question right before the thing, So again, the first one is that you just have limited mucus. The second one is that, like you mentioned, there's mucus all the time, or it's a very long mucus pattern. So as a fertility care practitioner, our goal is to make sure that the mucus pattern is no longer than 8 days, because you're trying to avoid pregnancy. And we know cervical mucus marks fertility. That means that if you have every day you're noticing mucus and you're avoiding pregnancy, that can be very frustrating, because you wouldn't necessarily choose to have intercourse on those days if you're actively avoiding pregnancy. So that's very frustrating. So again, as a fertility care practitioner, our job is to make sure that we can really identify the true mucus pattern, like the fertile window of time. And so that is also a key, where there could be other factors. There could be high vaginal discharge, where some women just have more vaginal discharge and the woman's confused between that discharge and cervical mucus. It could be seminal fluid. So if a woman's having intercourse, seminal fluid obviously comes from our husband, but we can notice it in our observations. So after intercourse, if you Kegel and bear down, we can kind of eliminate those. But that can be confusing if you're trying to avoid pregnancy, if you're having intercourse, trying to distinguish between seminal fluid and cervical mucus. Even something called a cervical tropion. That's when the inside of the cervix, those cells are exposed to the acidic vagina environment, and it causes discomfort within those cells. So then it can kind of start to tear up. That's what I think about when you get something in your eye and your eye kind of tears up. I don't know. That's how I think of it. Yeah. So a lot of women that I work with who have discharge all the time, and they're like, I'm so confused. Let's see if you have a cervical tropion. So we refer it to the physician, and then they can cauterize it or use silver nitrate, I believe, to heal up that space. So those are some things that women may notice that isn't just that typical like 5-day window of this mucus buildup. Sometimes it can be minimal, hardly any mucus at all. Sometimes it can be like non-existent. Sometimes it's just a little bit. Sometimes it's a lot. And so it can be hard to distinguish, but that's why it's important that people are trained so that they can work with women to really identify their fertile window.
It's great. Okay, so a couple points I want to bring up. With the mucus, with Creighton model, again, very standardized. It's like you could quantify it because the language around it is so objective. And that's why Jamie said that's what everybody learns the exact same way. And it's so important to have a healthcare professional, a fertility care practitioner to help you with charting with Naprotechnology. Mm-hmm. We do not recommend at all winging this on your own. So as we're talking about this, remember, we're going to put the resources for you to find the teachers and the healthcare professionals that actually can help you do this. What's cool about Creighton model is that because it was so heavily researched by Dr. Hilgers, what they were able to find out was that a woman who can identify her fertile window, and particularly something called the peak day, and the peak day has a very specific definition. It's the last day of stretchy, clear, or slippery/lubricative. They use the word lubricative, which basically means slippery. The last day of any mucus with one or all three of those properties. It doesn't have to have all. And this is very, very important because the peak day, like people will say to me, Teresa, and I'm trying to explain cervical mucus to them. They're like, oh, okay, so my peak day is the most fertile mucus day.
Right.
Right. And so they're thinking in their head, oh, it's just the day I have the most mucus. And that's not true. It's very, 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 like I said, so specific in Creighton model. It's the last day of stretchy, an inch or more of mucus, clear, crystal clear, like you can see through it like a window pane, and slippery. And this was researched with ultrasound. So they did over 3,000 ultrasounds to identify if a woman can find her peak day just by charting, does that associate correctly with where ovulation is? And in 100% of cycles, those ultrasounds showed that she was accurate within 3 days of ovulation. So it was very, very close, extremely close. Within 72 hours, a woman was exactly able to pinpoint where her ovulatory or her release of the egg was. And so that showed that Creighton model would not only be effective for helping identify ovulation for healthcare reasons, but for, again, avoiding pregnancy. This peak day was super accurate. And that's why it's, almost 99% effective for avoiding pregnancy, is because if you follow the Creighton model language for identifying your fertile window, you are spot on with ovulation.
Totally.
And the second thing, Jamie, before I just want to point this out, that seminal fluid elimination thing, I don't know how many other methods have, I'm sure they do have a kind of specific thing, but I've met so many women who went through their whole marriage not understanding that they could eliminate seminal fluid. And I just think, gosh, that really does create a confusing discharge pattern, and it's not always fun. So that's something I think that's important to learn for women who are, doing a natural method so that they have their own cervical mucus and nothing confusing in it. So Jamie, I want to kind of go through again what Napro is really good for and who out there could be a candidate who's thinking, am I somebody who would benefit from Naprotechnology? Who are those people? So I want to just list, Jamie, the conditions that most likely, and again, this doesn't include all things, but the conditions that maybe if you suffer with and that you have, Naprotechnology might be an avenue for getting to the root cause and getting restorative treatment for it. So number one would be infertility, because of course, infertility affects now 1 in 5 couples. It's a really big deal. And Naprotechnology, Jamie, this is so cool about, just the reality is when you get to the underlying root problem of anything, you think, oh, that should work better, right? Than maybe something else. And what's cool about Naprotechnology is for infertility, it's 2 to 3 times as successful as artificial reproductive technologies like in vitro fertilization. So a lot of great success in that area. So if you're struggling with fertility, Naprotechnology definitely could be something that you would look into. And again, we'll put the link to how you find a doctor who has been trained. Cramps, period cramps, terrible period cramps, especially those caused by the condition endometriosis, which we've had a podcast about here. And it's very important that it gets addressed correctly and with surgery. And, Jamie, if you want to jump in on any of these conditions, just let me know. But I'm going to list them out first, and then maybe you can highlight something that you feel comfortable highlighting on. So endometriosis, menstrual cramps, premenstrual symptoms or syndrome, ovarian cysts, abnormal bleeding or irregular bleeding, polycystic ovarian syndrome, miscarriage, and especially repetitive miscarriage, postpartum depression, dysfunctional or abnormal ovulation patterns, low progesterone, and any sort of discharge pattern that is abnormal as well. So sometimes called chronic or unusual discharge. So those are just a kind of a summary or an overview of some of the things Napro will address.
Right. And what I always think about when I think about women's health, specifically in terms of our charting, is that these things are symptoms of an underlying condition, right? So our menstrual cramps, that's a symptom of something further. Endometriosis, in a sense, I mean, that we could think about the root cause, but there's always like a very beginning point even of this. So endometriosis would cause the menstrual cramps, for instance, but what I think is interesting is even with endometriosis, if you're having a difficult time achieving pregnancy and you don't have super painful periods, let's just say, and you've explored every route that there was, you're doing progesterone, you have checked all your blood levels and all of that, it would be worthwhile charting with Creighton, working with a Napro doctor, and maybe even being referred for, exploratory surgery or a laparoscopy, just to see if you do have endometriosis lingering around. I have a friend who, is having a difficult time achieving pregnancy, does not have painful periods, but when she went to St. Louis, which is where there is a Napro surgeon, found that there was endometriosis everywhere. And good golly, So again, I think it's important for the listeners to realize that Napro doctors are trained in a very unique and special way, in a way in which most doctors are not trained when it comes to OB-GYN care. So endometriosis, I think, is one for sure. If you have a big question mark over why you're not getting pregnant, that's really important to kind of cross off the list. Also, when I was pregnant after having Emma, I, again, didn't realize after my first child that I knew I was to feel different, the baby blues. She's my first kid. I don't know what to expect. But, Naprotechnology came in like a knight in shining armor when I came to later realize that definitely I was experiencing postpartum depression. And it wasn't until later, of course, that I realized that I could use progesterone. But ladies who've just had a baby, even, like, what I love about Napro, Teresa, is that we can use this in nearly every stage of our life. It doesn't necessarily have to be right, in the crux of our childbearing years, but it could be leading up to that, or, as we're newly getting our periods and just kind of starting to understand what may be normal or abnormal. And as that season is kind of starting to close. So those are some of the things I just wanted to say, mostly with the endometriosis for sure, because there can be something called silent endo. And then for those of you who've just had a baby and you don't feel right, go chart your cycle and get to know your cycle. You probably aren't cycling quite yet. And see if you can get connected to a fertility care practitioner.
So, Jamie, I want to tell you a couple of stories. One, these are both recent stories in my practice. And of course, I could tell you 100 stories, but just to highlight it too, because you made a really good point about that this is for everybody at every stage. So a lot of times we think of fertility often when we think of Naprotechnology and treatment of infertility. But I had a patient, she was 15 years old, and she had been seen by her regular OBGYN for pelvic pain. And it was identified on ultrasound that she had an ovarian cyst. And the only thing that was being offered to her was birth control pills. And the patient didn't want that. In fact, maybe she even tried it, but it didn't work. And so they were looking for an alternative to getting this particular larger ovarian cyst that was causing her a lot of pain addressed. So she came to see me. I did my Naprotechnology protocols with her. For ovarian cysts, we'll use natural progesterone. It actually didn't work. And so, we did 2 rounds of progesterone and it didn't work. And this is unusual because in Naprotechnology with ovarian cysts, we have a really high success rate of using progesterone. But I knew there had to be something else as an underlying cause. And this is what's beautiful is I was able to partner with a Napro surgeon. This patient got in then quickly, and she had a cyst that would have never went away on its own. It was called a dermoid cyst. And the dermoid cyst needed to come out surgically. And so we were able to actually quickly get to the underlying root cause. Now, had the girl gone on birth control for months, that never would have been addressed. And she would have still been in pain. And on ultrasound, they didn't see that it was an abnormal cyst. So it was just a very interesting case. And then a second one was a fertility patient. And she was in her 30s trying to get pregnant for 5 years, had been to fertility specialists, had done all of the workup, but she wasn't getting pregnant, didn't have any symptoms of pain, but ultimately, again, partnered with a Napro surgeon after I did a full workup of her hormones. And what I could for her, she had like stage 4 endometriosis. And now she's healed of that disease. So you just never know. And I think, what the hope is in this is for those of you out there who have said to yourself, I've been to the doctors. Why does it feel like something is missing? Why does it feel like people aren't really getting to the problem, the root problem? And I think this is very common. It just kind of feels like women are being passed off. Like, oh, we don't know what's wrong with you. And so if you're someone out there who has felt that way, it's possible that a doctor trained in Naprotechnology may be able to help you further.
Yeah. And I think that's the huge, massive benefit, I would say, in charting with Creighton and seeing a Napro doctor. So we know, and Teresa and I are all fans of the wonderful fertility awareness systems that exist. We love them all. And maybe in the future, there will be other systems that do provide that step 2 or 3 really in medical training and surgical training. But that's really what you are getting with Napro help is you're opening that doorway if that doorway needs to be walked through for surgical intervention by a surgeon who knows women inside and out, no pun intended, but maybe pun intended, in regards to this mode of healthcare with the Napro lens, with the Creighton lens, with the women's health lens, and really getting to the root to restore that woman's health. So even for endometriosis, for instance, don't the typical surgeons or doctors, they laser the endometriosis off, for instance, but for us, we excise it. Or how do those two vary?
Yeah, I mean, for a regular doctor who isn't trained as a Napro surgeon, they might cauterize or, like you said, laser the endometriosis. And mostly the difference between a Napro surgeon is the excision, the type of meticulous care that they take in really truly getting out the endometriosis 100%. And then they also take meticulous care of the pelvis and the abdomen to prevent scar tissue. And they're trained to do that, in very particular ways. So yes, and I've often had patients who have gone to other doctors, just their regular OBGYNs for endometriosis care. And I always say this, I'm like, they get half-assed jobs, done on them. That it's like half their endometriosis was taken out and then they're left with scar tissue and it doesn't help their future fertility. It doesn't help their pain. So you need to go to a doctor who knows how to treat endometriosis appropriately. And Naprotechnology only has very specific doctors who are trained in those surgeries. And again, you can get that information through fertilitycare.org. So we'll put those links, like I said, in our notes so that you can get access to it. The other surgical kind of aspect of Napro, Jamie, that we've never talked about, but is something that is offered is for polycystic ovarian syndrome. There's a particular surgery that is used in some cases, and that's called an ovarian wedge resection. And it's been extremely successful for restoring cycles to normal, but also for fertility reasons. So if you've had PCOS and you have tried everything, if you can find a Napro doctor and talk about an ovarian wedge resection as an option, that's an incredible, incredible surgery that I've seen done and worked in so many patients. So
there's the ovarian wedge resection, but then there's also ovarian drilling. So why would do you know what that is? Like, what would be the difference between?
Yeah. So, I mean, back when surgeries were first done in this area, they did a procedure called drilling, and that's where they like literally just poke holes in the ovary, basically, for those who have polycystic ovarian syndrome. And it's kind of hard to understand if you don't really understand PCOS and what happens in the ovary. But the goal is to kind of eliminate some of the small dysfunctional cysts that are under the capsule of the ovary. However, drilling is problematic because of the scar tissue that it can form. So you're creating a lot of inflammation around the ovary and then leaving that to, just try to heal by itself. The difference between that and an ovarian wedge resection is that a wedge resection is a wedge of tissue. Kind of imagine that you're taking a piece of pie out of a pie, and you're just wedging a slice out of the ovary. Now that does seem extreme to people, but if you do it with an incredibly skilled surgeon, what happens is that you reduce the size and the volume of the ovary, you reduce the amount of dysfunctional cysts in the ovary, and literally it resets the ovary hormonally to be able to release its eggs again in an appropriate manner. So again, these doctors are trained to do this in a very particular way, but it is truly an incredible procedure.
So if there are women listening now and they definitely have been diagnosed with PCOS, what would move a woman to go to, that next step of surgery versus just doing kind of the typical regimen of lifestyle? Like why don't lifestyle factors help all women with PCOS if it is a lifestyle issue? So yeah, I guess where's that line?
Right. I mean, the line is different for everybody, Jamie. I mean, someone may choose an ovarian wedge resection earlier than somebody else because that's the pathway that they have chosen with their doctors. But you're right. I mean, is there other ways to treat PCOS? 100%. But if it fails, like not all lifestyle things will work for everybody.
Right.
That's just the reality of it. And some people still won't get pregnant. And so, especially in the area of infertility, if patients have not been able to get pregnant, and especially if you don't have regular cycles, this is a huge jump up in the ability for your body to reset the ovaries, reestablish normal, healthy, regular cycles, which literally then allows for regular natural conception to occur. Right. So it's just for those who are looking to conceive naturally, especially, this is just an avenue, but it is a very fruitful one for many people. So, Jamie, I know we've gone on quite a bit in this episode and we could talk about so much more. But to summarize again, I mean, Naprotechnology is natural procreative technology. The goal of it is to restore and find the underlying root cause of common women's health issues. The foundation of Naprotechnology is a very particular charting system called the Creighton model system, where doctors use it as a diagnostic tool. And they look at biomarkers in the chart to determine those underlying root causes of the woman's health issues. They do very particular hormonal testing. They can use ultrasound testing, and then sometimes surgical interventions to treat these underlying root problems. And in the end, the goal is restoration of the woman's body and restoration of her endocrine system. So like I said, Jamie, we'll put the information in the notes. And if you have anything else you want to add in about Naprotechnology, it would be great.
Yeah. Ladies, just want to say you are worth fighting for. You, even though this may be so exhausting, if you're struggling with infertility or pain, like your womanhood, your cycle is just giving you so much pain, whether it's physical pain, emotional pain, and it doesn't seem like there is an end in sight. You are not getting answers, you are getting frustrated, and you're feeling hopeless. Our encouragement to you is that there are answers, hopefully, and that you are worth finding those answers for. And so one thing I'll just say too is that in every experience I've had working with women who've gone the surgery route, not only are the surgeons, of course, well skilled, but they also treat you with such loving care. So I have a really good friend who got surgery by Dr. Putoff in St. Louis. And she's like, it was like the eyes of Jesus, like looking at me right as I was going under, like so much love and care. And I know at the Institute, they pray for you and they pray over you. And it's like even silently in themselves, they care so much. It's not just a job, means to an end. It really is this like mission heart that these surgeons have for the women they serve, because they really believe in the cause of getting to the root of helping you restore your fertility and your health. So even if, again, it's like the bedside manner I've heard is just incredible. So that's the last thing I want to say. Women, if you're not feeling seen and heard, at least explore this route. Fertilitycare.org is where you're going to find your closest fertility care practitioner. A fertility care practitioner helps you understand your cycle, helps you understand how to chart so that a Napro doctor can already, progress through and try to get you the help you need a little quicker, running labs, getting a diagnosis for you. And then if you need a surgeon, then they can refer you on with your charting and with that history. So I wanted to end with that the ladies, you ladies are worth fighting for. And we see you, and it can be very hard, but there are loving surgeons that really want to serve.
Thanks, Jamie. That's great. And as a Napro provider myself, or Napro healthcare professional, I totally agree with you. I do it because I love it and I care about people. So thanks, Jamie, and we'll talk to you real soon.
Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside